MedicentreV V3 is designed to cater to an eye clinic's specific workflows, ensuring seamless patient care management from registration to follow-up. It supports the entire diagnostic and treatment process by integrating tools for vision acuity, eye examination, refraction, optical prescription, and other specialized procedures. This improves the precision of diagnosis and treatment. The system also optimizes appointment scheduling, ensuring efficient patient communication and managing inventory for essential eye care supplies. Additionally, MedicentreV V3 aids in compliance with healthcare standards and provides insightful reporting to improve clinic performance. This comprehensive approach improves both patient outcomes and operational efficiency in the eye clinic. When a patient arrives at the eye facility, their first interaction will be with the reception office for registration. To access the registry panel, the receptionist can use the shortcut available on the homepage panel. If the shortcut is missing, they can right-click on the home page as demonstrated. In the Options menu, select Add Shortcut. In the pop-up window, you can scroll down to find your desired shortcut or use the search bar to quickly access and select the panel. It's important to note that any service provider can add their respective shortcuts to their homepage panel for easier access to their panels. Click the Add button to save your changes. You can either click directly on the panel to access it, or you can navigate to the clinical module and select Registry as shown. Both approaches will lead you to the same panel. On the Registry panel, fill the required fields. The mandatory fields are marked with red asterisks. Fill in the patient's surname and other names on the provided fields. Using complete names can help reduce errors, improve communication among healthcare providers, and ensure proper documentation. Select the sex from the drop-down. Input the date of birth. You can use the date of birth field or click on the pencil icon on the right to add the age. Choose the patient's identification type. Add the patient's identification number. If the identification type was none, you can skip the identification number field. Enter the telephone number and select the occupation of the patient. If the occupation is not on the drop-down list, click on the Add icon on the right to add the notification. Add the patient's residence. Residence refers to the specific place where the patient lives. Select the town of residence from the drop-down list. If the town is not on the drop-down list, click on the Add icon on the right to add the town. Town refers to the administrative area within which a person's residence is located. Select the nationality of the patient. Add the next of kin's name. Next of kin refers to a person's closest living guardian or family members, who are identified as emergency contacts responsible for making decisions on behalf of the patient if they are unable to do so themselves. Add the relationship the patient has with the next of kin. Add the next of kin contact or phone number. To add the customer scheme, click on the customer scheme. On the customer scheme window, fill the required details. Select the scheme of the patient. Input the membership number or the card number of the patient as provided by the scheme. If the patient registered is the card holder or the primary member of the scheme, check the flag is principal member. If the patient registered for treatment is not the card owner or is a secondary member of the scheme, input the principal member's name on the principal member field provided. After inputting the customer scheme, click on Add button and close the window. For cash-paying patients, you do not need to add a customer scheme, as the system will add the default scheme automatically. In this video, we've just learned how to add a customer scheme to a patient. However, moving forward, we'll be using the cash scheme as our default scheme. Click on the Add button to save the patient's details successfully. Patients have to be queued to the point of service. This ensures good patient management and instills fairness in the facility as the queue observes the principle, first come, first serve. After successful registration and saving of the patient details, the system displays a prompt, Queue this patient. Click on the prompt to queue the patient. The queue window is displayed for you to select the next room the patient is heading to. Click on the To field and select the room the patient is heading to. Click on the clinic and select the medical clinic the patient wishes to visit. Click on the Visit Default Scheme and select the scheme in which the patient is using for the visit. If you added the customer schemes during registration, ensure to select the default scheme. However, as mentioned earlier, we're going to use cash as our default scheme. On the Note field, you can indicate a note you wish to communicate to the room the patient is headed. Click as Emergency if the patient needs urgent care. This will ensure the patient appears first in line on the queue. If it is a revisit, check the As Revisit flag. To issue a queue ticket for the patient, ensuring they are aware of their number when it appears on the queue panel, click on Print Queue Ticket. Click on the Queue Patient button to successfully queue the patient to the next room. Once the patient has been successfully queued, the receptionist will guide them to the billing area to settle the consultation fee before moving on to the visual acuity. Billing patients for consultations immediately after registration is crucial for financial accountability, operational efficiency, and enhancing the overall patient experience. Once a patient has been successfully registered and queued, their details will be listed under Patient Bills. The system can be configured to automatically bill the patient for the consultation fee upon successful queuing after registration, or you can choose to add the charges manually. To bill a patient, follow these steps. The cashier or the service provider in charge will navigate to the billing module and select Patient Bills as shown. A new window will appear, displaying the pending bills for that date. You can filter the dates to view pending bills within a specific time frame as needed, then click View. In the View section, you can also perform the following actions: view pending bills with no balances, pending bills with balances, finalized bills, and all bills. From the list of pending bills, select the patient for whom you wish to bill the consultation fee. You can use the search bar if the list is extensive. It is important to note that you can open the billing window by either double-clicking the patient's name or selecting the patient by clicking on their name once, then clicking the billing button in the top right corner of your screen. Both actions will take you to the same billing window. In the billing window, select the bill item. The amount to be paid will be indicated as shown. Next, select the type of sale from the drop-down menu. Cash sale. This transaction occurs when the customer pays the full amount for goods or services immediately using cash or other instant payment methods such as debit or credit cards or mobile payment. Credit sale. In this transaction, the customer receives goods or services immediately, but pays later, either by an agreed due date or in installments, requiring an invoice to be created outlining the payment terms. Partial payment. A customer can use different payment methods to settle the bill, such as paying part of the amount in cash and the remaining balance via mobile money. The receipt will reflect both payment methods, confirming that the total amount has been fully settled. Offset from deposit. This refers to a financial adjustment where a payment or charge is deducted from an existing deposit held by a customer. Make your selection according to the type of payment. Select the mode of payment and enter the amount tendered. Finally, click Save Payment to generate the receipt. You can print the receipt to issue to the patient. Issuing a receipt after payment provides proof of payment and aids in financial record keeping. Then, instruct the patient to proceed to the visual acuity room. The visual acuity panel is used to assess a patient's vision sharpness and clarity, aiding in the diagnosis and management of eye conditions. To access the visual acuity panel, you can use the shortcut on the home page or navigate to the clinical module and select Special Clinics. In the subsequent window, the system will display all medical clinics configured within the facility. Choose Visual Acuity as shown and ensure you are signed into the designated room to access patients queued for assessment. When a patient is queued, their record will appear in the mini queue list. which displays the patient's ticket number, OPD number, name, origin, and the time spent in the queue. Before proceeding with the assessment, it's important to note that the fields in the panel are customizable based on specific information you want to capture. This flexibility allows healthcare providers to tailor evaluations to meet clinical needs, enhancing diagnosis and patient care. In this video, we will demonstrate how a clinician can use the configured panel. To begin, select the patient by clicking on their name. The patient's demographics will be displayed in the Patient's Details section. The panel can record acuity for the right eye, left eye, or both, as required. In the Acuity field, select the VA from the drop-down list. The panel is configured to use the Snellen chart, but you can also set it up to use the Logmar test if preferred. Record the visual acuity with glasses for both eyes using the drop-down list. Next, capture the pseudophakic visual acuity, which is used to assess patients who have undergone cataract surgery and have an intraocular lens implanted. Use the VA pinhole field to record acuity with a pinhole occluder and the VA pinhole over glasses field for assessments while the patient is wearing glasses. The near vision acuity field measures how well the patient sees objects up close, typically using a near vision chart. Complete the remaining fields according to your configuration. Capturing a patient's history during the assessment is crucial for understanding potential underlying causes, guiding accurate diagnoses, and developing effective treatment plans. Record the patient history as shown, and finally, click Save to store your entries. The patient summary provides key details such as medication history, visit records, lab results, and clinical notes, offering an overview of the patient's health and treatment. Below the panel, the Previous Visits section displays reports from prior appointments. You can click on the Visit Summary report if you wish to view it. Once all steps are completed, click on the Actions button and select Queue Patient to send the patient to the next service point. The eye exam panel streamlines workflows, improves data accuracy, enhances patient tracking, standardizes procedures, and increases efficiency, ultimately leading to better care quality and patient satisfaction. To access the eye exam panel, navigate to the Clinical module and select Special Clinics. In the subsequent window, the system will display all medical clinics configured within the facility. Select Eye Exam to proceed. Ensure that you're signed into the eye exam room to access patients queued for examination. When a patient is queued for the eye exam, their record will appear in the eye exam mini queue list, indicating the patient ticket number, OPD number, patient name, patient origin, and time spent in the queue. It is important to note that the fields are customizable based on your specific requirements. This flexibility allows healthcare providers to tailor assessments to meet clinical needs, ultimately improving diagnosis and patient care. To select a patient, click on their name once, and the patient's demographics will be displayed in the Patient Details section. The data captured at the visual acuity point will be displayed at the patient summary card for your reference. In the eye exam slit lamp panel, fill in the fields according to your configuration to ensure accurate data capture. Capturing patient history and clinical notes is vital for comprehensive care, tracking changes, personalizing treatment, enhancing provider communication, and ensuring legal documentation, all of which improve patient care and clinic efficiency. Document the patient history as shown and make selections based on your findings for both the anterior and posterior segments of the eyes. Select options for both eyes for uniform findings or enter results separately for the right eye and left eye when conditions differ. Start by inspecting the eyelids and choose the appropriate options for either both eyes or for the right eye and left eye individually. This helps identify any abnormalities, ensuring proper tear function, and detecting potential signs of infection and inflammation. Next, select the status of the conjunctiva after examining for signs of infection, inflammation, or redness. Proceed to assess the cornea, selecting the status after evaluating for clarity, scratches, or ulcers, ensuring accurate documentation for both eyes. Choose the AC status based on depth and clarity, checking for fluid buildup or inflammation, which helps identify conditions like glaucoma. Examine the iris for shape and color irregularities, documenting any findings for both eyes. Evaluate the pupil for size, shape, and light response, selecting the appropriate status for both eyes and noting any abnormalities. Check for lens clarity, selecting the status and documenting any signs of cataracts or clouding that could affect vision. Documenting the posterior segment is crucial for detecting conditions like retinal detachment, macular degeneration, and glaucoma, ensuring early intervention and long-term vision care. Start by examining the vitreous for clarity and signs of floaters, hemorrhage, or inflammation, and select the status from the drop-down for both eyes. Check the retina for any tears, detachment, or signs of diseases like diabetic retinopathy. Ensuring accurate documentation by choosing the appropriate status for each eye. Evaluate the macula for signs of swelling, degeneration, or holes, selecting the findings from the drop-down, as the macula is key for central vision and fine detail perception. Finally, assess the optic nerve for color, cupping, and edema, which can indicate conditions like glaucoma or optic neuritis. Document the status for both eyes to ensure a thorough evaluation. By completing these steps, all critical elements of the posterior and anterior segment will be examined and documented, providing a comprehensive view of the patient's eye health. Select the MOH diagnosis to ensure standardized terminology aligned with national health policies, enhancing communication among healthcare providers. Noting any forms of disability in the patient record allows for tailored treatment plans, ensuring that patients receive appropriate support and interventions. You can enter your remarks and then click the Save button to save your entries. Entering the ICD-10 or ICD-11 diagnosis facilitates accurate documentation and systematic health data collection, essential for epidemiological studies and health planning. To enter the ICD diagnosis, click on the Actions button and select Diagnosis. In the pop-up window, choose from the list of ICD codes, utilizing the search function for easy access. Select the code and click the plus button to save, allowing for multiple diagnoses to be added and saved. From the Actions button, the ophthalmologist can also perform various tasks, including referring a patient, recording patient vitals, performing a physical examination, making lab request, radiology request, and theater request. Scheduling appointments with patients, viewing patient appointments, assessing and planning before admitting a patient, generating prescriptions, and optical prescriptions for eyewear, billing patients, generating sick notes and consent forms, configuring order sets, picking a patient in admission for assessment, uploading files, and creating an external request form. Various reports are available, including special clinic summary, visit summary, lab report and lab report, test per page, theater report, examination report, all visits reports, and blood trend report. You can select the report you wish to view. Below the panel, there is the patient's previous visits section that shows the report of the patient's previous visits. You can click on the visit summary report if you wish to view it. After confirming that all steps are complete, click on the Actions button and select Queue Patient to send the patient to the next service point, which is refraction in this case. The refraction panel in eye care plays a crucial role in providing accurate vision assessments, diagnosing refractive errors like myopia, hyperopia, and prescribing customized corrective lenses. It improves patient comfort and visual clarity through tailored prescriptions while also streamlining clinical workflows and reducing errors. Additionally, the panel allows ongoing monitoring of vision changes, ensuring consistent and effective eye care management. To access the refraction panel, use the shortcut on the home page or navigate to the clinical module and select Special Clinics. In the new window, the system displays all medical clinics available. Select the refraction panel as shown. First, ensure that you are signed into the refraction room to view patients queued for refraction. The mini queue displays patient's ticket number, OPD number, patient names, their source location, where the patient came from, and the time spent waiting on the queue. It's important to note that the fields are customizable and can be configured to capture the specific data you require. Selecting a patient from the queue is straightforward. Click on the patient's name once, and the system will display their demographic information in the Patient Details section. The data recorded during the visual acuity and eye examination will be visible in the Patient Summary card for reference. Once you've selected the patient, fill in the refraction details as required. To create an optical prescription, click on the Actions button and choose Optical Prescription. In the next window, the system displays the refraction panel, prescription panel, and billing panel. Under Subjective Refraction, select the sphere values for both the right and left eye, representing the degree of nearsightedness or farsightedness. Select the cylinder option to measure the degree of astigmatism, as this enables accurate assessment of the corneal curvature irregularities responsible for distorted vision. Next, choose the axis ranging from 0 to 180 degrees to set the correct orientation for astigmatism correction, ensuring precise lens alignment for improved visual clarity. Use the Add option to input any additional lens power required for near vision. Finally, choose the visual clarity measurement, which helps determine the sharpness of vision and guides lens prescription. To verify the prescription, move to the Trial Frame Findings section. Here, select sphere values for both eyes, and then choose the cylinder option to record the degree of astigmatism. This step is vital for ensuring the correct lens curvature to address visual distortions. Choose the axis to align astigmatism correction accurately. Use the Add option for any near vision corrections. And finally, measure the visual clarity again to confirm the sharpness of the patient's vision. After entering remarks and the name of the refractionist, click Add to save the details. To finalize the optical prescription, click on the Prescription panel. In the displayed window, select the type of prescription from the drop-down list, input the doctor's or clinician's name, and enter any remarks. Click the plus button to save the prescription. Next, proceed to Billing. Click on Billing to open the billing window, and from the drop-down menu, select the item. If needed, you can change the billing scheme by selecting Customer Scheme and making the appropriate selection. To modify the billing price, check the Change Unit Price box and enter the new price. Please enter the quantity in the designated field and click the plus button to save it. If a discount is applicable, enter the discounted amount along with any comments and then save your changes. Once complete, the refractionist directs the patient to the cashier's office for payment.